Morning all, a big day ahead, for it is now that we are going to learn how the Prime Minister plans to get us out of lockdown. A lockdown he is clearly hoping will be our last. Boris Johnson will reveal a cautious roadmap to ease restrictions to MPs in the Commons this afternoon before leading a news conference in Downing Street at around about 7 o'clock this evening. The nationwide approach involves 4 tests. This morning, we can reveal the first details of what we're expecting to hear from the Prime Minister later. Sky News understands that on March the 8th, all schools, primary and secondary, in England will reopen. Outdoor school sports and activities will be allowed to begin the same day. The aim, it would be to also allow people to meet one other person in an outdoor public space, for example, for a coffee or a picnic from the same date, the 8th of March. Sky News understands the next phase of reopening will be on March the 29th, when outdoor gatherings of either 6 people or 2 households will be allowed, including in private gardens. On that day, the aim is also to reopen outdoor sporting facilities such as tennis courts and golf courses. Our political correspondent Joe Pike has this morning's first report.
12 months into the crisis, and today Boris Johnson will announce the way out. So far, we know all schools in England will open on March the 8th. Outdoor after-school sports and activities can restart, and you'll be able to sit outside with one other person for a coffee, drink or picnic. And from the 29th of March, the first Monday of the Easter holidays, groups can meet outside to a maximum of 6 people or 2 households. At the same time, outdoor sports facilities like golf courses and tennis courts can reopen, and grassroots football can return.
We know that the probability of transmission outdoors, in particular with just 2 people meeting up, is much, much lower than it is indoors. So that's not a terrible idea at all. The idea that schools are going to go back all at once, I think, is a little bit more of a risk, because there's been a study by the London School of Hygiene and Tropical Medicine which suggests that we aren't going to be able to keep the reproduction number below 1 if all children go back to schools at once.
This is just stage 1. At each of the 4 stages, 4 tests must be met, including whether the government's vaccine deployment programme continues to be rolled out successfully. It will also require evidence that vaccines are effective in reducing hospitalisations and deaths among those who have been vaccinated. It will depend on infection rates not risking a surge in hospitalisations that will put unsustainable pressure on the NHS. And finally, that the assessment of risks is not changed fundamentally by new COVID variants. MPs will vote on the roadmap in the coming weeks, but some are already impatient.
Everybody accepted at Christmas time, because of the new variant, we needed to go into lockdown again. But now that everybody's seen the success, thank goodness, of the vaccine, and I pay huge tribute to everybody involved, the Prime Minister, Kate Bingham, the Health Service, Business Department, fantastic achievement to get this vaccine to where it is today. But everybody's now, I think, hoping that on the back of that, with more millions and millions of more people being protected by the month, that we can actually now use that as a platform to launch getting more and more of the economy open again.
The full roadmap will be announced in the Commons this afternoon, ahead of a Downing Street news conference tonight. Lockdown is lifting, and hopefully for the last time. Joe Pike, Sky News, Westminster.
Joining us once again on the programme, the Vaccines Minister, Nadhim Zahawi. Mr Zahawi, always good to have you on. And as always, a very busy day, very busy week for you and the rest of the government. Clearly, everyone is very keen to discover how and when we might be exiting lockdown. And at the core of all of that are the 4 tests that the Prime Minister is deploying. Run us through those.
Good morning, everyone. Yes, of course. So it will be, first of all, the vaccine programme continuing at pace. So we will offer the vaccine to the over 50s by the middle of April and all of the adult population by the end of July. The second is that the vaccines are working and that we're seeing a reduction in infection, hospitalisation, and of course, death. The third of which is that infection rates are not rising because of the different parts of the opening up of the economy to a level which will overwhelm the NHS and, of course, in terms of hospitalisation. And the fourth is variants, i.e. that we are managing to keep variants under control, and that we're not seeing what we saw, sadly, just before Christmas, which is the new variant becoming more infectious and the dominant variant in the country, and leading to the large-scale hospitalization that we saw in December, January, and of course, even now. So they are the 4 tests. It is making sure that we proceed at each step and are able to assess and then flex accordingly. But you'll hear more from the Prime Minister, both in the Commons when he presents the roadmap, but also tonight in the press conference.
Sure, and there will be parents the length and breadth of England looking enviously at the date of March the 8th for all the schools to reopen. However, just in terms of the 4 tests that you've outlined, the second of those, the evidence showing that vaccines are reducing hospitalisations and deaths in those vaccinated. Do we yet have that evidence? Do we yet have that information? Certainly not in the public domain by my reading.
So the Prime Minister will say more about this, but you will know that Public Health England have been running a couple of large-scale studies. The Siren study, which tests the frontline health care staff who were in Group 2, if you recall, of the vaccination programme, so very early on. And another study called Vivaldi, which has been testing care home residents. Again, they were Group 1. And of course, the other evidence, but the Prime Minister will be saying more about that. Suffice to say, the evidence looks good. The Oxford team demonstrated their own evidence of cutting transmission by 2/3. And of course, we wouldn't be in this place this morning to be able to say that we're going to reopen schools on the 8th of March. And of course, as the school holidays begin on the 29th of March, we will look at the rule of 6 and 2 families being to see each other outdoors. If we haven't, if we're not confident that actually the vaccine programme is beginning to really bear fruit.
Sure. Can we just be absolutely clear, though, with all schools reopening on March the 8th, the expectation has to be that the number of infections will increase?
So that, as I was saying to you at the beginning, all of that goes into the gradual, cautious reopening of schools and then gradually reopening the rest of the economy. As we vaccinate more people, it is not a coincidence that the 8th of March is the date that we have focused on, because if you take the mid-April date where we will have given at least 1 dose to all over 50s, offered that 1 dose protection to all over 50s, if you go 3 weeks after the middle of April, that takes you to the first week of March. Now, that phase 1 is 99% of mortality. So it's no coincidence that we are opening schools after 3 weeks of protecting the over 50s and that phase 1, and then we'll carry on.
I get that. Sorry to interrupt, Minister. The reason is we have heard for a few days now, in fact, and from yourself on the programme last week, that the way out of this is to be incredibly cautious, is to open things gradually. I mean, the one aspect of the roadmap in which it doesn't feel particularly gradual is getting kids back into schools. You look at Wales, you look at Scotland, they're going in a phased return to school, so they can look at the data, see what happens in schools as children go back. Why are we not doing that? Because it doesn't feel cautious. It feels somewhat incongruous, actually, to reopen all the schools on one day and say that this is a cautious approach.
Well, I would say to you, it's actually quite the opposite. If you look at where hospitalisation and, of course, death has come from with this pandemic, it is from that 1 to 9 group, all the way from the over 80s, those obviously that are clinically extremely vulnerable, but then also the over 50s. So we're waiting until all of that group, the over 50s, have got the protection, i.e. 3 weeks after getting their first dose, before we reopen schools. And of course, we do know that infection amongst children is very, very low. And so this is a cautious, slow and deliberate reopening, as we continue, of course, to assess the 4 tests that you and I have just described to your viewers.
I understand that certainly some of the evidence that it suggests that transmissibility amongst children it's not as much of an issue as it is amongst yourself or myself. But you only need to look at, for example, I mean, there are examples of this all around the world. The situation in British Columbia and Canada at the moment, where the Kent variant is running havoc through the school system there, a number of schools having to have temporary closures. Look, we understand that the plan, as outlined by the government, is that we don't roll back. Once something is relaxed, that is the way of it. But you have to say that there could well be a big pause in this roadmap coming as we look at the data that emerges from the school system.
So hence why the fourth test, if you go back to your first question, the dominant variant in the UK is the one that you refer to as the Kent variant. The vaccines have very high efficacy against the dominant variant, which is why we're confident on the vaccine effectiveness. The vaccine rollout continues to be going to plan. We've in fact brought it forward, more ambitious by mid-April to offer the vaccine to over 50-year-olds, all over 50-year-olds. But there is a but in there, which is to say we have to make sure that infection rates and hospitalization also remain under control, which is the third test. And the fourth test, back to your Canadian example, is that we keep control on variants and make sure that we have that ability to sequence, which we have, genome sequence, one of the largest in the world. We account for about 50% of all sequencing of COVID mutations. And of course, surge testing and isolation, as we've been doing with the variants that we've discovered from South Africa, for example, and make sure we keep that under review and control. So it is cautious. We have to be careful. We want it to be sustainable, as you quite rightly described.
Can we talk about the second key date in all of this, March the 29th, which you've already mentioned? Of course, the suggestion is that might be the point that we see the end to stay at home, indeed the end to stay local. Plenty of people up and down the country, myself included, will be wondering if that is the point at which those of us who live some distance from our families might be able to go and see them. Outside, of course, you're not allowed indoors. Is your reading of the relaxation that people can travel at a distance to see their family on March the 29th, if everything goes well?
Quite right. If everything goes well, this is outdoor versus indoor. We know there is plenty of evidence to suggest that outdoor, the transmission is much lower. It is allowing two families to be able to come together outdoors, or the rule of six. And it is a national rule rather than a regional or tiered rule. So I think the important thing is to wait to hear from the Prime Minister this afternoon in Parliament, but also this evening on the details.
Sure. But I will push a little bit on this. My producer working with me this morning, he lives in Leeds. It might be possible for him to get home and come back in a day, whereas for me, to go home and see my family would potentially involve an overnight stay in Scotland. Of the two, are either of those, in your mind, either not possible, not permitted, or not advisable?
So as long as it's outdoors and it is two families or the rule of six, then that is what will be permitted. If the four tests continue to be delivered upon, then that will be the national lockdown. Of course, Scotland, as you mentioned, and Northern Ireland and Wales will be setting out their own roadmap towards reopening their economies as well. So at the moment, the focus is very much on, steady as she goes, outdoor versus indoor, priority being children in schools. Second priority is obviously allowing two people on the 8th of March to meet outside for a coffee to sort of address some of the issues around loneliness and, of course, mental health as well. And then the 29th is two families or rule of six coming together and outdoor sports activities as well. Tennis, golf.
Sorry, Minister, can we then just be absolutely candid? Even on the roadmap, as I understand it, even in the best case scenario, pubs, restaurants, non-essential shops, hairdressers, beauty treatments and the like, none of that will be happening, even in the best case scenario, until the other side of Easter.
Well, however much tempting it may be, Neil, I will not preempt my Prime Minister before he stands up in the chamber, the dispatch box, and describes the roadmap to parliamentarians and to the country, and of course at the press conference tonight. I think it's important that we do this cautiously, steadily, based on the vaccination rollout, which has been, I think, in many ways, one of the great achievements of the coming together of the NHS, our armed forces, the volunteers, the doctors, nurses, the private sector that delivered the vaccine, both in terms of the scientists and the manufacturers, but also that delivering now for us in the deployment with the distribution. So a lot of hard work has gone in, and we don't want this hard-won, achievement to be in some way jeopardized by us, emotionally feeling that we've got to try and go faster. We've got to be led by the data, not the date.
And very, very quickly, because I know you have to go, can you offer a cast-iron, set-in-stone guarantee that there will never be another national lockdown?
I think the important thing is to make it sustainable. You're absolutely right. Now, the Prime Minister, if I look at my own portfolio, has tasked us not only to deliver the largest vaccination programme in the history of the NHS and of this country, but also to look at variant vaccines that may be needed as an autumn booster if we need it, and of course a longer term future-proofing of the vaccination programme. So I'm confident that if we do this cautiously and we do it based on the data, the evidence, then it will be sustainable. And it should be the last time we ever enter this severe level of lockdown because of COVID-19.
Nadhim Zahawi, good to see you this morning. Thanks for being with us.
Thank you.
Our political correspondent, Tom Rayner, in the studio this morning. Good to see you, Tom. What did you make of that? Actually, I wonder if we just might start with the last thing that we heard from the Vaccines Minister there. This should be the last national lockdown, but I suppose it's absolutely to his credit that he said he would not go so far as to promising that it would not be.
I think politicians have learned lots of things over the pandemic, but not making themselves hostage to fortune is certainly one of those that we've seen coming through. I think what was notable, actually, is that Nadhim Zahawi clearly doesn't want to steal the thunder from the Prime Minister ahead of his appearance in the Commons and the press conference later. And that indicates the government really do feel that there is good news here, even though the watchword is caution, even though every statement is caveated with having to meet the tests and obligations. I thought what really stood out, though, Neil, was when you asked about one of those tests in particular, this idea that the vaccines are showing efficacy, particularly against hospitalisations and deaths. You said that data is not yet in the public domain. Nadhim Zahawi said, well, look, wait for the Prime Minister. But I thought that was a pretty heavy hint. He said that the evidence looks good and that we wouldn't be in this place this morning if we weren't confident the vaccine programme was really beginning to bear fruit.
Tom, many thanks indeed. Now, some pupils in Scotland and Wales will be returning to the classroom this morning. In Scotland, children in early years education and the first 3 years of primary will go back, while in Wales, children aged 3 to 7 will start a phased return, as well as some students on college courses. In England, well, as we were just hearing, the Prime Minister expected to say that all pupils in all years will be able to return from March the 8th. Our correspondent, Ivor Bennett, is at Stephen Primary School in East London Forest. Good to see you this morning, Ivor. Look, I suppose from the part of the professional educators, they know when they will be going back. Some questioning if they know how they will be going back, if you see what I mean.
Yeah, indeed. Well, look, here at Stedman Primary School in East London, the head teacher and the teachers here, they are all absolutely delighted with this news that they'll be welcoming all their children back come March the 8th. They say schools are much better places with children in them, of course. They have had the children of key workers and vulnerable children, of course, during lockdown, but they haven't had all 700 pupils since before Christmas, and they can't wait to have everyone back. So they're delighted. Parents, too, I think, will be overjoyed with this news because it means no more homeschooling, and children similarly, they are desperate to get back into the classroom and to see their friends. But there are concerns about this on the safety level from unions, whilst they do of course recognise how important it is to get children back into the classroom as soon as possible. They say it would be reckless to bring all year groups back at the same time, and they would much rather see a phased return of year groups similar to what's happening in Scotland, Wales and Northern Ireland. And so clearly still some safety concerns around this, but on the whole here at least they are broadly welcoming this move.
Ivor, many thanks indeed. We'll be speaking to Ivor throughout the show. Also coming up at 7:30, I'm going to be joined by the Shadow Health Secretary, John Ashworth. Ahead of those announcements on easing lockdown, plenty to discuss with him. We'll be taking a closer look at what the roadmap means for hospitality and leisure with the Chief Executive of the British Beer and Pub Association and the boss of Pure Gym, both joining us at 8:30. And then at 8:45, we're joined by an intensive care consultant looking at the challenges still facing frontline medical staff. But of course, the big event of the day. From 3 o'clock, we're going to have live coverage of Boris Johnson's statement in the Commons. That will, of course, be followed by the Downing Street briefing at 7 o'clock this evening. And on top of all of that, we're bringing you a special programme, Easing the Lockdown. Anna Botting in charge tonight from 9 p.m. Let's take a look at a few of the day's other news items now. And the Foreign Secretary, Dominic Raab, is to call on the military to step aside in Myanmar and release the country's elected leader, Aung San Suu Kyi, in an address to the UN Human Rights Council later. It follows demonstrations over the weekend against the military coup, in which 2 protesters were reportedly shot. Boeing is recommending the temporary grounding of all its 777 aircraft powered by a type of engine that suffered this catastrophic failure. The United Airlines flight was forced to make an emergency landing after its right engine blew apart after takeoff on Saturday, raining debris, as you can see, over Denver. No one was hurt in the incident. The airline, as well as others in Japan, is removing the aircraft from service while an investigation is underway. Riot police and protesters have clashed in Barcelona for a 6th night over the jailing of the rapper Pablo Hasél. Bins, stones and other objects were hurled at officers guarding the National Police headquarters before Catalan police moved in with vans to clear the streets. Shops in Barcelona's city centre were also targeted over the weekend by vandals who broke windows and looted. Israel has closed all its Mediterranean beaches following an offshore oil spill. Authorities are still searching for the source of the problem, which led to tar washing up along 100 miles of coastline and devastating wildlife. Officials say it's one of the most serious ecological disasters in the country's history. Health certificates will be required for sausages and mince entering Northern Ireland from Great Britain under the terms of the Brexit protocol. The temporary documents are due to be scrapped from July, when the meats are set to be banned altogether from entering the region under strict EU laws on animal and plant health. Now, thousands of cancer patients say the pandemic is leaving them out of pocket and struggling to pay for the basics, which is leading to many suffering from depression and anxiety. One charity is calling on the government to make the £20 per week increase in universal credit permanent to help those in most need. Sky's Hanisha Sethi has the details.
Judith may be all smiles now, but living with stage 4 bile duct cancer meant the mother of one faced huge pressures.
Financially, the burden was enormous. The extra money that I received in benefits helped me to have, and I'm going to say the luxury, even though I feel that it's a need, you know, but it allowed me the luxury of not having to take public transport, which again, during COVID, I can't even begin to explain to you what it feels like when you're fighting for your life anyway, and then to have the added burden of the fact that even going to an appointment could actually infringe on your life.
It's not just mobility that's a prime concern. More than 100,000 people with cancer in the UK are struggling to pay for basic essentials. Ahead of the budget announcement on the 3rd of March, one leading charity wants urgent clarity on universal credit commitments.
If you're going through a cancer diagnosis or treatment, you shouldn't have to worry about the financial costs or paying your bills at the end of the month. So that's why we are calling on the government to continue the positive measure they put in place last year to increase universal credit by £20 a week for those on the lowest incomes.
70% of people with cancer who are struggling with living costs have also had anxiety and depression as a result of COVID-19. For Judith, her message is not to give up.
Cancer doesn't have to be a death sentence. you can live with cancer, you know. And actually, with the support that's given to you, I wouldn't say that you can live the same life as you led before, but you can still have a really good quality of life.
It's already an extremely tough battle to face, but if financial implications are eased, it could be an easier climb for some. Hanisha Sethi, Sky News, Essex.
Time now to see how the weather is looking this Monday morning. Isabel is at the wall with the details. Isabel, good to see you. It was quite, well, it felt warm when I stepped out the house this morning. Who'd have thunk it?
Yeah, no, it's mild, and over the weekend, a few spots got close to 16 Celsius, 61 Fahrenheit. The average at this time of year near around 10. It does look as though the mild weather will continue, but some changes too. Let's take a look.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Brighter for western areas today, but there will be some rain across central parts that will gradually fizzle out as it moves eastwards. And then this Atlantic depression set to whip up the winds and bring some heavier rain, particularly to the north and west through Tuesday and Wednesday. This morning, though, with the rain clearing from the borders of Scotland and continuing to ease away from Wales and western parts of England, so brightening up here through the morning, lovely and sunny across the north and west. But the cloud obviously fairly extensive across more central areas with some rain at times, and that will gradually push its way into East Anglia, perhaps the southeast for a time as well this afternoon. But for many, it's an improving picture as that rain clears through. And then to start tonight, it's fine, a little bit chilly in the east with some patchy mist and low cloud, but the west turns increasingly windy and wet. And the problem is this rain gets stuck across the north and west through the course of Tuesday and Wednesday. Heavy rain running up through Ireland, up into Cumbria and Scotland. And the Met Office and the Scottish Environmental Protection Agency, SEPA, that looks at the flooding, particularly concerned across southern and central Scotland, where we could see around about 5 inches of rain.
The weather, sponsored by Qatar Airways.
Isabel, many thanks indeed. Do stick with us. Still to come on the programme as the PM prepares to plot the way out of lockdown. We'll be joined by the Shadow Health Secretary, John Ashworth's up next.
The nature of warfare is changing. An invisible enemy is on the rise, in a grey zone between war and peace. It's a global battlefield that thrives on deniability. The weapons of choice include disinformation, intimidation, and cyber attacks. Everyone's a target. Into the grey zone from Sky News. Warfare is changing, and now we're all on the front line. Listen and subscribe wherever you get your podcasts.
Welcome back. Time, as always, to have a quick look at the latest UK coronavirus figures. Yesterday, we saw 9,834 new confirmed cases of COVID-19 recorded in the most recent 24-hour period. A further 215 people have died within 28 days of testing positive. That brings the UK total to 120,580. And more than 17.5 million first doses of the vaccine have now been administered. In the last half an hour, I asked the Vaccines Minister about one of the government's 4 tests for reopening the country, which is that vaccines are reducing hospital admissions and deaths. I asked if we were already seeing some evidence of this.
Suffice to say, the evidence looks good. The Oxford team demonstrated their own evidence of cutting transmission by 2/3. And of course, we wouldn't be in this place this morning to be able to say that we're going to reopen schools on the 8th of March. And of course, as the school holidays begin on the 29th of March, we will look at the rule of 6 and 2 families being to see each other outdoors. If we haven't, if we're not confident that actually the vaccine program is beginning to really bear fruit.
The Shadow Health Secretary, John Ashworth, joins us on the programme. Mr Ashworth, good to see you. You will have read as much as I'm sure that I have from the papers. You'll have looked at the briefing that there has already been. From that which we understand the roadmap to look like, what do you make of it?
Well, this has to be the last lockdown, absolutely. So it is, the broad parameters do sound reasonable. We have to proceed with caution. We have to be driven by the data, not specific dates. We have to be continually alert to the potential of new variants, because we know this virus is now it's like a moving target. We know it can mutate, and we don't want to grow our own new mutation that can evade the vaccine. We've got to lock in the success of vaccination, therefore, by continuing to suppress the virus, which is why we're saying you've got to do more to break transmission chains by paying people decent financial support to isolate themselves. It's unacceptable that 70% of applications for the £500 payment are turned down. So we're calling on the government today to fix that, because it's a hole in our defences, so that if you're sick with the virus or you're a contact, you can stay at home to protect both yourself and to protect others.
It's not been that much more than a week since the government first started using the line that you just used, that we need to be data-driven, not driven by dates. I wonder whether it's kind of not data, not dates, but data plus dates. There are some significant dates, in fact, included in the timetable in the roadmap as we're expecting to be set out later on. And perhaps the most key amongst it, that date of the 8th of March for all schools in England to go back. Does none of that give you pause? The idea that unlike Scotland, that unlike Wales, we won't see a phased return to the classroom, but in essence, get them all back in, sit back and see what the data tells us 3 weeks after?
Well, of course, schools have been, excuse me, schools have been open throughout this crisis for the children of key workers. I've always said that children may not be the face of this pandemic, but risk being amongst its biggest victims. It has to be in the interest of children and society that our children are back in learning in the classroom, because we know children out of school impacts their development, it impacts their mental health and their well-being. But we do have to be cautious. We've got to make sure that there are measures in place to keep schools safe, like requirements around ventilation and air filtration, guidance around mask wearing, that perhaps they set up Nightingale hospitals, so beg your pardon, Nightingale classrooms. So there are there are other buildings and units are put in place so the children can be spread out. Because what we don't want is to reopen schools to all children and then they have to close again because infection rates rise.
To what extent, though, is that innovation that's been taking place in the education sector being done by, the teachers, the senior management teams in these schools, and how much of it has been directed by central government? The complaint that I've heard from a couple of teachers over the weekend is that, well, look, we know when we're going back, we just don't know how we're going back.
I mean, you're absolutely right. I mean, this is a time of absolute crisis for our children, and I think we've probably got the poorest education secretary in history at the helm. He should be working with schools, he should be working with trade unions, he should be working with school governors and teachers to make sure that there is a proper plan in place to keep the schools open, to keep them safe, and to help and support pupils catch up on the learning that they will inevitably have missed. Now, we know there's been online Zoom calls and home learning, but it's not the same as the children being in the actual classroom. So this has to be a big national priority now to support our children and to give them the resources and to give them the investment that they need so they can develop and they can catch up.
Do you foresee a situation in which the entire process, the return to normality, or at least to degrees of normality, the pause button could be hit pretty quickly, couldn't it? If we start to see levels of transmission in schools, which other parts of the world have seen in primary and secondary schools, particularly with the Kent variant?
Yeah, well, it's a trade-off, which is why if we're going to reopen schools to all pupils, which I believe we should do, that will place upward pressure on infection rates in epidemiological terms. So you've got to make a trade-off as society. Yes, you've got to put in place the mitigation measures in the schools themselves, but it means you've got to keep other bits of society closed, like pubs, like hospitality. I think in the end, this is about your priority as a nation. And my priority is putting our children first. It's not reopening the pubs. On saying that, I recognise that those businesses impacted will need help and support. So let's expand the business rate relief. Let's offer a VAT cut to hospitality and retail, because a lot of jobs and livelihoods are at risk as well, and they can't be left behind either. So let's offer financial support to them.
Mr. Ashworth, thanks for joining us once again on the programme.
Thank you.
Well, let's stick with schools. Many teachers, many parents are concerned about the return of their children being done safely. Sky's Becky Cottrell has been visiting a school in Kent where a much-loved member of staff died of COVID-19.
Mel Machulski loved children, and she'd made a career caring for kids. The students she helped now face returning to school without her. At just 51 and with no underlying health conditions, Mel died from COVID-19.
She was lovely. She lit up a room with her smile. There wasn't a day went past where she didn't make you laugh so much. She was just a lovely mum and a brilliant, brilliant mum.
When COVID struck the school where Mel worked, 33 members of staff were infected. Her partner Pete says school workers must be vaccinated.
If we need schools to return, we most certainly need to do something about it, because I think there will be more deaths.
At Dover Christchurch Academy, Mel provided pastoral care for the school's youngest students.
There's a lot of concerned staff, as you would expect. 900 students within this building, 150 staff members. It's impossible to see how we can actually socially distance or make sure that everyone stays safe. However, on the other side of things, students need to be in school.
Today, the Prime Minister will lay out his roadmap for leaving lockdown. Getting children back into the classroom is his priority, and the 8th of March is the target he's set. But is it safe to let kids come back then?
Experts predict that by restricting a return to school to primary years and only a small number of secondary school students, we could keep the R number below 1, meaning infection rates would still be declining. But if all children go back, the R number could go above 1. And if other lockdown measures are eased, transmission rates would be even higher.
So this is our gymnasium, which we've turned into a lateral flow testing facility.
While we wait for all adults to be vaccinated, testing remains key. But for students, will that responsibility fall to schools or parents? Here they are ready to test children, if needed, when they come back. But their return will be tainted by the loss of their affectionately nicknamed Mrs M. Becky Cottrell, Sky News, Kent.
Well, let's speak now to Steve Chalk, head of the Oasis Academies Trust, which runs more than 50 schools across England. Steve, great to have you on the programme this morning. You, I imagine, will know better than most the negative impacts that there have been on our young people because of this prolonged period away from face-to-face education. What then do you make of all schools, primary, secondary, all years within them, all returning to an educational environment on March the 8th?
Well, the devil's in the detail, isn't it? So what does all schools returning mean? I think that we all know all children learn best in a classroom, and we're excited about the opportunity of children coming back. We know it's essential. But if you look at Scotland and you look at Wales, what they've adopted is a phased return or a staggered return. And that's for all sorts of reasons. And we would say the wise way forward is a step-by-step gradual return where you can monitor how you're doing, and you can monitor whether you're going too fast and slow down a bit or too slow and speed up a bit. It seems to us, it seems to me, that that's the only sensible way forward, because our freedom has got to be won. It won't just arrive in our laps. So I think we need to be cautious and move ahead in that way.
It isn't part of the problem with that, you know, there will be kids who would go back in, under your idea, there'll be kids who go back in on March the 8th. One presumes there would then have to be a period of perhaps a fortnight, perhaps 3 weeks, as is happening on the government's own roadmap, before more might be allowed in. I mean, it could well be the case on a phased return that there are some children who simply don't get back to face-to-face learning this side of the summer.
Well, I think that another way you can do it is to have rotas. So you could divide your whole school into cohort A and cohort B. And if I'm in cohort A, across a 2-week period, I get exactly the same education in school as cohort B. On the first week, I come in on Monday, Wednesday and Friday. And the second week, I do Tuesday and Thursday. And so that at the end of 2 weeks, every child has had the same in-class experience and given projects to take home. I think the important principle that emerged out of that really sad film that you've just shown, the important principle that arises is that if you can't social distance, actually you become a vector for the transmission of this virus. And though it may not have damaging impacts long term on the children, it can do and it will do on some staff. So one of the things we could do is still, perhaps the Prime Minister will announce today that all school staff are going to be vaccinated. There are only 1 million school staff in the country, and we're vaccinating 1 million people a day now. So you could vaccinate every staff member of a school in a 24-hour period, which means that everybody else would only have to wait an extra day to get their vaccination. That would keep staff safe. But you've got to create social distance as well for the children so that they don't spread the virus back into the community. So phased or staggered returns, a rota system, and then one of your guests earlier talked about marquees in playgrounds and on school playing fields. If you want good ventilation and if you want cheap extra space, marquees in the warmer weather we're going to get is definitely the way forward.
Well, Steve, I think I know what you're going to be doing at around about 3:30 when the Prime Minister gets to his feet to set all this out. Watching Sky News, I suspect. No, Steve Chalk, thanks for joining us in the programme this morning. Appreciate it.
Thank you.
Still to come on the programme. Well, as lockdown is lifted, what challenges do the police face? We're joined by the National Chair of the Police Federation. That's next.
One tea bag, 2 sugars for the wife and cafeteria with Colombia means that's just something for me, and it's like these are the days.
Toxic masculinity are these ideals that we can tell ourselves are really positive. For example, never crying, but you go through difficult situations in life and you realize that actually those ideals can be quite detrimental to your mental health. I mean, I was conditioned from a young age that what makes a man is strength and dominance and never crying and getting on with things really quickly. I think growing up on a council estate had a part to play in that. And I think culturally being a first generation Brit and having to really fight every day, my parents, to make a way in this country probably contributed as well. But when my dad passed away in 2017, I tried my best to be, this kind of macho man that never cried. But it didn't really work for me. And I ended up 3 months later kind of breaking down in floods of tears on a beach somewhere. And after I had cried, it was one of the most freeing moments I'd ever felt in my life. And that's when I started to explore. Maybe what I was taught and conditioned to believe made a man wasn't truly accurate. When I was 15 years old, one of my friends got murdered on the council estate, and everything within me wanted to grieve and cry and show emotion. But because I had this picture that men can only be strong, I suppressed it, and it started to damage me on the inside for years to come. So you're absolutely right. There's nothing wrong with being strong. But I think when your body and your mind is telling you that you need to express emotion and you need to let it out, it's absolutely fine to do so.
Ahead of the Prime Minister outlining the route out of lockdown, the Police Federation is calling on the government to avoid mixed messages. It comes as new research suggests that only 10% of officers felt that powers previously introduced were clear. We're joined now by John Apter, National Chair of the Police Federation of England and Wales. John, good to see you again. Talk to us a little bit, if you can, about the concerns that your members are raising. Look, we are coming out of lockdown at some point, and of course the police will have a role in enforcing whatever the conditions are. On the basis of what you've read, how difficult is the job going to be?
Good morning, Neil. It's going to be really difficult, and I know it's difficult for so many people for so many different reasons, but speaking for my colleagues, so I represent 130,000 police officers across England and Wales. And throughout this whole crisis, there have been ever-changing bits of legislation. I think we've had almost 70 bits of legislation change in that period of time. And my colleagues have done the best they can. In times of crisis, we step up, we do the best we can to protect each other and keep the number of deaths to as much of a minimum as we can. But it's been really hard. And we survey our members to make sure that people like me are speaking on their behalf. And really alarmingly, despite the best efforts of everybody, only 10% of officers, 1 in 10 of those surveyed, and it was many thousands, said that the legislation that was brought in during the crisis last year was clear. And bear in mind, Neil, they're the ones who are having to enforce it. And we've seen examples where we might have got things wrong because it's not easy. It's not easy to interpret what is the legislation, what is guidance. The public over the year, certainly by the end of the year, were getting more frustrated. There were mixed messages. There was an encouragement for people when we were coming out of one lockdown to get out and about and meet with their friends, but legislation was still in place in some areas. So for today's announcement, I plead with the Prime Minister just to give absolute clarity. And where we are frustrated is that this will only apply to England. Wales and Scotland, Northern Ireland, all of the nations will do things slightly different, which in itself is really unhelpful, especially for us who represent officers across England and Wales.
Yeah, John, sorry to interrupt. We've got a finite amount of time. When you and I have talked a number of times over the pandemic, and both of us have separately raised the idea that policing happens in this country with the consent of the public. What effect does a lack of clarity about the rules have on, the average member of the public's ability to consent to being policed?
It puts a strain on that relationship, and that is one of my biggest concerns when we come out and get to whatever normal is going to look like, is what relationship do we have? I think during this crisis, the vast majority of the public have completely understood that policing is in a difficult place, and they've supported policing, but they only support it if we don't have to police them. And there are good, decent people who have fallen foul of these rules, and we've had to enforce in some cases, in many cases. I think the mixed messages have been deeply unhelpful for my colleagues who are out there on the front line doing their absolute best. The Prime Minister has a chance today to try and set that record straight and give the clarity that my colleagues need, which in turn will help the public.
John, are you detecting any suggestion, of course, that they're currently working out the protocols for phase 2 of the vaccine rollout? Have you had any back-channel indication that the police might well be prioritised more than they have been?
Certainly in the early days, we were in discussions with the Home Office, National Chiefs Council, which is the chief officers of policing, from early December on this. And certainly the indications we were getting was that police officers who are up close and personal with people. We can't police with social distance, unfortunately, and many colleagues being spat at and coughed at. So there is I believe, a very strong rationale as to why my colleagues should be prioritised. There was an indication that they would be, and that was snatched away. And I think some elements of the public sector, and we've heard earlier about teachers, do feel bitterly let down by this. And I know it's a contentious issue, but if my colleagues are expected to police in the way that they're expected to police, they need to have the full support of government, and that also includes having access to the vaccines. We have 130,000 police officers across England and Wales, nationally, including police staff and special constables who are just as deserving of this vaccine, probably a couple of 100,000 police officers and police staff. That would take probably half a day in the current climate to vaccinate.
John,
public sector, some parts of the public sector have been let down.
So sorry, John, we are once again out of time, but I'm sure it won't be too long before we speak again. John Apter from the Police Federation, thanks very much indeed. Time for us to have the weather. Here's Isabel.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Brightening skies for the north and west today. Quite pleasant, actually, with some sunshine. Temperatures after a chilly start getting up to about 12 in Dublin, 10 or 11 for Edinburgh. Now, across England and Wales, there is some rain creeping its way gradually eastwards. It does cover central parts for a good part of the day, but then tending to tail off by the time it gets into the southeast. Not too bad tonight, but it's set to turn wet and windy tomorrow.
The weather, sponsored by Qatar Airways.